Hi, this is Brian Kim. I want to share with you case number 147 in the Best Way to Do Cataract Surgery series. This is a 1 to 2 plus dense lens, a small pupil, and I'm going to show you in slow motion, careful and detailed explanation of the double chop and cross chop technique and why this is a safe surgical execution of the lens disassembly. Why, even though people think that, the pupil small, you should put something in to make it bigger, that I don't really need to do that because I can confidently disassemble the lens because I know I'm within the capsular bag with all the maneuvers. So this is a cotton tip to steady the eye, and this is a corneal marker, which will help me to center and size the rexus. This is my paracentesis incision. I'll make it first on the right side and then the left side, making sure I'm parallel to the iris plane, which creates a nice corneal shelf, which will allow me to achieve a self-sealing incision. This is intracameral lidocaine, and then some intracameral epinephrine, and then some dispersive viscoelastic to coat the corneal endothelium and to flatten the anterior capsule. And this patient has a little bit of a Bell's reflex. You can see here, this is the left eye. So I'm using the cannula to turn the eye, and this is a triplanar corneal incision. I make a vertical groove, place the blade into the deep part of the groove tunnel, and then enter. And I use a cannula to control the eye with that maneuver. Using the cannula to remove the air bubbles. And this is the Haldi-Perkar capsulorhexis forceps. These are the blunt tip ones. This is an older video, so I'm puncturing with the blunt tip forceps, pulling down, grabbing the right side of the tear and going around circumferentially. And that pupil size right now is a bit comparable to the corneal mark that I made. So I'm going around. Finish off the rexus here, burp some viscoelastic out. And this is the capsular fornix hydrodissection technique. I place a cannula under the rexus edge contra-incisionally. Very carefully make sure I nudge it in the capsular bag, point down, get a nice wave, come out, decompress on the left side, sweeping along underneath the rexus edge on the left side, pointing the tip down, hooking the lens on the right side, and the lens begins to spin. It's important that when you're doing hydrodissection on a small pupil, you don't do too vigorous of fluid because it can cause increased pressure within the anterior chamber and the iris may come out. So I lift the incision with the chopper, go in with irrigation off to minimize Descemet's trauma, removing the surface epinuclear material. And here we go in slow motion. You see my chopper, my hand is pronated, so the chopper is pointed out to the periphery. I remove the surface epinuclear material because by removing the central epinucleus, I can make sure I push the lens down underneath that epinuclear ridge as I go out. By doing it this way, I'm 100% confident I'm still within the bag. So you can see here, I'm doing that again. Chopper tip is flat against the lens. I'm leading with the tip, going underneath the epinuclear ridge, rotating my hand now so the chopper is up and down now. So now I'm definitely within the capsular fornix with the chopper. And then I'm rotating the phaco tip vertically subincisionally, but I'm within the capsular rhexis opening still. In this soft lens, I don't have to make a diagonal chop. I can actually make a chop with horizontal vector forces because the lens is soft. So I turn the phaco tip vertically. It's deep within the lens material, embedded up until the sleeve. I bring both instruments together slowly. And as I do this, it meets in the middle. The two instruments meet in the middle. I'm able to perform lateral separation. And look, you can see clearly that the lens is fractured in half. Again, this is a 1 to 2 plus dense lens, small pupil, but I can confidently fracture the lens even though there's a small pupil. I pronate my hand again, make sure the chopper comes out flat again. And now I'm going to go after the right heminucleus. I make sure I'm down underneath the epinuclear ridge, slide the chopper out to the right, get to the capsular equator, rotate the chopper now. You can see my hand rotating, so now it's straight up and down. The chopper is vertical. The phaco tip is still between the lens pieces. So that means that I can actually apply a horizontal force because the chopper and the phaco tip are at the same level of the lens material. I pull the chopper centrally towards the phaco tip. I crush the lens against the phaco tip. You can see there's two quadrants now, and with lateral separation, I've fractured the right heminucleus in half. I'm using the chopper to make sure that pupil doesn't come towards the phaco tip, and I use some vacuum to grab that first quadrant. You can see the first quadrant starting to come up out of the bag. Again, I'm using that chopper to support the pupil, make sure it doesn't try to come towards the phaco tip with the high vacuum. And then I sandwich the lens with the instruments. And emulsify the lens piece. Perform the same maneuver on the second quadrant. Pulling the chopper against the phaco tip, it fractures a small piece, and then I turn the lens and use some vacuum to pull that fragment up. I'm going to rotate the second heminucleus in front of me, place the chopper around the lens, pulling it centrally toward the phaco tip, which is positioned deep in the bag, fractures the lens in half, using some vacuum to pull that third quadrant up, crushing the lens between the instruments, and then emulsifying the lens piece. So this is the fourth quadrant. I'm putting the chopper around the lens piece, crushing it in half, and then once it's small enough, I start to emulsify the lens piece and remove it. That's the last endonuclear fragment. And then I go after the epinucleus, which starts to tumble out nicely. You want to make sure that you use pulses of vacuum so you don't accidentally grab the iris in this situation. So I take the chopper out, push BSS in, take the phaco tip out, and I go in with the INA handpiece. I always start subincisionally, removing the cortical material from anterior to posterior, peeling the cortex off. You want to be mindful in these cases. You don't use too aggressive vacuum. You can't really visualize the capsular bag because of the iris here. Switch to polish mode early. As a result, polishing underneath the rhexis edge of any cortex and lens epithelial cells. Again, because the phaco machines are so good now, you can really apply significant aspiration and vacuum forces. And so it's important to make sure you don't accidentally grab an important structure like the capsular bag, which can actually damage the zonules. So that's why I love the polish mode in this setting, especially when the visualization is suboptimal. So I'm using a cannula to pulse into the subincisional capsule fornix, which is clean there. Injecting some cohesive viscoelastic to fill the capsular bag. I'm going to just do some very gentle sweeping because, again, I don't really see the bag very well. But I can feel that I am polishing underneath the capsule here. With these smaller pupils, I do suspect there might be some zonulopathy. So this is a 3-piece lens. I widen the incision with my diamond blade. I go in bevel down. That didn't quite work. Probably have to widen a little bit more. My incision's at 2.4, and those 3-piece lenses really need to go in through a little bit of a larger incision. So widen the incision. Inject some more viscoelastic, especially in this context. When I was pushing, a lot of OVD came out. I'm able to go in, bevel down, turn the bevel to the left. Go ahead and deliver the leading haptic into the bag. Rotate my wrist so the optic comes out flat. Use the Maltzman to push the optic-haptic junction so that the trailing haptic goes into the bag. Using the Maltzman to ensure that both haptics are in the bag now. Go in with irrigation off. Activate irrigation. Go underneath the optic, removing the viscoelastic from within the bag. Repositing the lens back. Again, making sure that the haptics are both within the bag with the Maltzman. Polishing underneath the rexus edge. Switching to visco mode, removing the viscoelastic from the anterior chamber, and then I'll hydrate my incision. Again, this is 1 to 2 plus dense lens, small pupil. And again, I'm showing the double chop and cross chop in slow motion to illustrate the point that don't feel like, oh my goodness, this is a small pupil. Why is he doing this? This is so dangerous. I would never do this. Well, I mean, you shouldn't do this if you're doing the lens disassembly the way you normally do, and you depend upon visualization of every step. I agree. If you have a technique that is limited that way, then you shouldn't perform the lens disassembly through a small pupil. However, when you're doing double chop and cross chop, it's not based upon fluidics. You're not using high vacuum and aspiration to go after the lens pieces in the bag. If you do that, you're going to grab something that you shouldn't. You might grab the iris, you might grab the posterior capsule, and that can be very, very dangerous. And then you have a complication for no reason. But because this is all through careful placement of the instruments within the capsular bag, making sure I'm in the bag within the rexus opening, pushing down, getting out to the capsular equator, fracturing the lens very confidently because of the mechanical forces that I'm applying. Again, all of the maneuvers are within the capsular bag, hooking the lens pieces up, crushing the lens pieces with cross chop, pulling the lens pieces up with the chopper, emulsifying the lens in the central safe zone. I have tremendous confidence and exquisite control over the eye, and I know exactly where I am and what I'm doing when I'm disassembling the lens in this context. And as a result, I feel like if anyone tries to perform the double chop and cross chop and they perform it successfully, it's really like a light bulb. It's nothing like you've ever done before. It's not like divide and conquer. It's not like stop and chop or vertical chop or horizontal chop. It's very, very different because you're using tactile sensation and understanding of where your instruments are to just crush the lens. It provides tremendous versatility and it opens up your opportunities to be able to have much more competitive advantage to disassemble the lens in these challenging cases. So I hope this was helpful to you, and I thank you for your attention.